Thank you, Mr. Speaker, and I'm pleased to rise today in support of the Conservative Opposition Day motion. The NDP has long been a proponent of creating a national strategy on autism, and we look forward to the day that we have one that is more than a mere paper entity. Canada's current approach to autism spectrum disorder has let down thousands of Canadians on the autism spectrum and their families. We share their disappointment and we stand with them in their call for action in support of the Canadian Autism Partnership. We continue to see a significant increase in the number of Canadians being diagnosed on the autism spectrum, yet all across Canada, vital services, supports and resources have not kept up with the increasing need. It's time for the federal government to finally sit down with the provinces and territories to negotiate an accord backed by real funding to address, number one, the lack of applied behavior analysis and intensive behavioral intervention, and which is also known as ABI-IBI in Canada's school systems, and the lack of public health care coverage for behavioral treatments, and the lack of appropriate housing accommodation for adults on the autism spectrum. The Liberal government's refusal to fund the Canadian Autism Partnership, CAP, at $19 million over 5 years is rather indefensible. While this model isn't a substitute for real funding to provide essential services and supports for those on the autism spectrum, the CAP would play an important coordinating role at the national level. The NDP believes that given the scale of the problem, it makes no sense for the Liberal government to refuse to make this small investment in so worthwhile an initiative just because it's something that was brought forward by the previous Conservative government. Of course, this refusal to fund would be entirely defensible if the Liberals were bringing forward their own well-funded and targeted national strategy, but I think we all know that such a plan isn't forthcoming. While autism isn't a matter that any of us should be playing politics with, and on the other hand, it is unfortunate that the previous Conservative government never got around to backstopping their own initiative with the funding or political commitment necessary to improve the service delivery and supports. As Kathleen O'Grady, the research associate at Simone de Beauvoir Institute and Concordia University, has noted, autism doesn't affect Liberals or Conservatives or NDPers. It's an equal opportunity neurodevelopment disorder that affects Canadians across the political spectrum and clear across the country. I'd like to take a moment to look at some of the specifics of autism in Canada. At this time, 1 in 68 children are currently diagnosed with autism spectrum disorder. ASD is caused by a combination of genetic and environmental influences, and it is now the fastest growing and the most commonly diagnosed neurological disorder in Canada. And as my honourable colleague had stressed earlier, its prevalence has increased over 100% in the last 10 years. Autism occurs in all racial, ethnic, and socioeconomic groups, and it is a lifelong spectrum disorder. Mental health concerns such as anxiety and depression are common in individuals with ASD. And sadly, the unemployment rate for individuals with ASD is over 80%. Treatments for those on the autism spectrum can cost between $50,000 and $100,000 each year. Yet, depending on their place of residence, not all affected Canadians have access to the same quality of care. Provincial health plans do not provide equal coverage, equal levels of coverage, and wait lists are often several years long. People on the autism spectrum lose access to public education and specialized services as they grow older and become adults. Lastly, the most important point I'd like to make is about early intervention. Early intervention makes a lifetime of difference. We've heard this from so many professionals who came forward and talked to me during the election campaign, who are professionals and work with children, and were applauding our proposed early childhood affordable daycare strategy, because early interventions are so much an intricate part of what a national strategy would entail. With the right supports, all individuals with ASD and other disorders can thrive. The earlier the intervention, the more successful the outcome. We know about early intervention leading to success no matter what challenge a child may have. The earlier we can identify that a child needs support, and the earlier that appropriate support can be provided at the right time and in the right way for that particular child, it is 1,000-fold more likely that the child will be more successful than he or she would otherwise have been. Because they've had early intervention, we see children who are now in the regular school system, and we see children graduating from high school and university. As I mentioned earlier, New Democrats have always been champions on this issue. And going back to 2006, the NDP health critic Don Davies previously introduced Bill C-327, an act respecting a Canadian Autism Day, in recognition and support of the many Canadians affected by autism spectrum disorder. We believe, however, that at this point in time, there have been enough studies, enough roundtables, enough consultations, enough motions debated in this chamber, and as well, let's not forget, the Senate. It is time for us to do something. No one following this issue for any length of time can be forgiven for being just a tad cynical about the debate we're having here today. There's been everything done around this issue except for the serious concrete action required, backstopped with the right amount of funding that matches the scale of the challenge that is presented to us. If this is not why we're here today, then we may as well move on to something else, as I have no intention of further insulting and hurting the families and caregivers and institutions that have been dealing with this matter for decades. And these people have invested so much of their time and expertise into the real meaningful consultation they thought they were bringing forward in the model proposed to the Minister of Health. Canadians are looking to us for leadership and for action. That's why we're here. So let us please, I urge you, give it to them today. Let us no more kick this particular can down the road. I mentioned the Canadian Autism Partnership Project earlier, and I'd like to elaborate on what this project entails, as I believe it is pertinent to this debate. The partnership was launched with an investment by the Government of Canada in July of 2015, and it was charged with developing a National Autism Spectrum Disorder Working Group and Self-Advocates Advisory Group, a comprehensive stakeholder engagement strategy, and the development of a business plan for the implementation of a permanent Canadian Autism Partnership. Since CAPP was launched, the National Working Group, along with the Self-Advocates Advisory Group, has guided the stakeholder engagement process, including 22 meetings with 101 government representatives in all provinces and territories, 17 consultations in 14 communities with relevant stakeholder groups, and 4,371 responses to an online survey hosted by the CAPP website. Throughout the process, special focus has been placed on the needs of Indigenous people and Northern communities to identify their priorities and the appropriate methods to examine meaningful responses to their service needs, both on and off reserve. The development and implementation of CAP represents a comprehensive approach that would address systematic issues and complex needs of individuals on the autism spectrum. And I believe this partnership is step one in beginning to introduce and seriously address this issue. I'm proud to support it here today.